It's now the 8th of January 2010, day 5 of my Cladribine therapy, and as you can see, things have got a bit more interesting. I had the last of my injections today and they went okay, but last night I was feeling a bit feverish, a bit shaky every now and then really hot flushes. A blood test that was done today has shown that I'm now completely neutropenic, so I have no immune system. It's also shown that somewhere in my body there's an infection that's growing and getting more fierce. I can't feel where that is at the moment. I've been slightly chesty, but I don't have a cough or anything. There's no pain anywhere or anything to indicate where the infection might be. But rather than send me home and see if it gets any worse, they've decided to keep me in, and I'm on a drip of antibiotics and saline. Apart from that, putting the drips in, there's been no discomfort so far, and hopefully now that the antibiotics are in, this is as bad as it'll get. I'm going to be here all weekend, and then depending on how my bloods turn out on Monday or Tuesday of next week, I may be here for 5 or 6 days, but we shall see. Okay, it's now the 9th of January 2010, and the 6th day of my Cladribine treatment, although I'm not being treated with Cladribine anymore. The last injection was yesterday. I'm still in the hospital though, because I'm even more neutropenic than I was yesterday. There's still signs of infection. I think that's probably on the chest. I feel very short of breath, and I feel as if there's a cough coming on. But it hasn't really got any worse than yesterday, so hopefully the flow of antibiotics is keeping it at bay, and this is the worst I'll get. Other symptoms I've had so far: yesterday my hands were very dry and a bit sort of rashy and not itchy, but the skin was beginning to chap, and I think half of that is a side effect of the Cladribine, and another half of that is just the constant use of alcohol gels to try and keep infection at bay in the hospital. I haven't left this room for the last 24 hours, or more than that now actually, since I was admitted. And slowly I've managed to get family to bring stuff in, like a laptop and books and magazines, to keep me sane. I really should have put all of these together in a bag, ready to go really, because being in hospital is pretty much inevitable in this treatment. So I should have prepared that earlier. Other side effects: my hips are really sore, particularly if I sit down and my whole body weight is on them. I don't know if that's the marrow in the hips kind of being broken down by the Cladribine, and if that will get better. I assume it will. And the only other symptom is that when I brush my teeth, my gums now bleed. Not profusely, but it's noticeable. But that's to be expected apparently. But the cough doesn't feel any worse, or the chest doesn't feel any worse than it did yesterday, so hopefully the constant flow of antibiotics will keep that at bay, and that apart from the fact that I'm stuck in this room until at least Tuesday, which is now still 3 days away, apart from that I feel fine, and the treatment's going well. It's now the 10th of January 2010, and the 7th day of my chemotherapy treatment for Hairy Cell Leukaemia. It's quite late now, it's just gone 11 o'clock at night, and I'm quite tired. Not a great deal has happened today that was any different from yesterday, aside from the fact that I managed to get up and have a shower. That involved putting a face mask on so that I wasn't going to pick up anything from anyone on the wards that I was passing on my way to the shower, and it involved tying up my lines with some plastic aprons so that no water got into them. But apart from that, it was fine and very welcome. It means that my hair's now not quite so greasy, albeit it's still quite unkempt, because I haven't had it cut since I was diagnosed and told not to go anywhere crowdy. My neutrophils are now down at pretty much 0, so the treatment's had its effect. The only way now is up really. Today I've had 2 units of blood transfused, and some more intravenous antibiotics and more pills that they've got me on here. I still feel fine. My chest hasn't got any worse. It still feels a little bit like something's there, but it's no great discomfort. I'm in no pain at all, and nothing else seems to be getting worse. I've had no gastric issues. Rashes are pretty much gone now. So that's all fine. There's not a great deal else to say really, but I think for the importance of these videos, it's good to see how each day goes and what I look like each day. It's as treatments go, and people I've seen on wards adjacent to my room, I'm doing pretty well, or it's a pretty good treatment to have to go through compared to some leukemias, which are clearly a lot more traumatic. But that's it for today. I feel quite tired, but I think that's to be expected at this time of night for anyone. So that's it. Tomorrow is Monday, so there'll be more bloods taken and my consultant will be in, and I guess more decisions will be made as to how well my treatment's progressing, how long I've got to stay in this room, and whether I need any more bloods or antibiotics. But that is for tomorrow. It's now the 11th of January 2010 and day 8 of my chemotherapy. It's exactly a week now then since I had my first injections. I'm still in hospital. My chest is still quite funny. If I do deep breaths, then I have a real compulsion to cough, so I'm breathing quite shallow. I'm very tired today. I've had to have lots of frequent naps. I've had some little twinges just under my left rib, which I assume is my spleen getting smaller, but I don't know. There's not a great deal else to say really, other than the tiredness. I had a blood transfusion which started yesterday, and that finished today, and I feel a lot more human. Certainly looking in the mirror, my skin colour seems to have improved. Dark bags have gone from under my eyes, and I had little blood spots on my skin in various places, and they all seem to have gone as well. My temperature did get up to 37.5 today, just once, so there's still an infection rattling around somewhere. There'll be more blood tests tomorrow, and we'll see how we go. At the moment, I'm going to be here at least for another 2 days, but it'll depend obviously on tests tomorrow and on Wednesday, whether I stay here any longer. But that's it for tonight, and I need to go to sleep again. It's now the 12th of January, and I've lost count of what day it is of my treatment. I'm still in hospital. I've spent most of today asleep. I've been very feverish. My temperature's registering well over 38. I've been very shivery all day, so haven't really done much. They've got me back on a drip and on intravenous antibiotics, which seems to have had an effect on the fever. That's come down a little. They don't quite know what the source of the infection is that's causing the fever. I've had a chest x-ray, I've had a throat swab taken, I've had blood cultures taken and blood samples taken. Tomorrow they're going to give me a CT scan of my chest to see if there's any fungal thing on my lungs. Apart from that, I'm very bored. I'm not allowed out of this room, and I'm not allowed to have a shower while I've still got this fever. So it's quite dull. At the moment, I feel fine. I had a paracetamol earlier, which seems to have taken the fever down. But that's about it for today. It's not been great, and I just can't wait to get out of this room and be even slightly normal again.